right, so I'm going to just ask some questions, and they're going to answer them. And we'll see what they say. Okay, so Barbara, how did you find out about myself or my group, Western Monmouth Orthopedic Associates?
Well, two ways. One, I do work in the OR, so I found out about it.
So Barbara says she works in
Two ways. I do work here in the hospital, so I have met Dr. Nasar before I had the surgery. The second way, I was a patient of Dr. Goldberger, and I went into Dr. Goldberger's office and for an appointment, and he goes to me, "I'd like you to speak to Dr. Nasar." So I said yes, and when Dr. Nasar came in, he looked at my x-rays and he asked me, "What am I waiting for?" Because my knee was quite bad, and that's how I...
Tell us, why don't you lead into what it was like, actually, before the surgery? How bad was it? What couldn't you do? That kind of thing.
I basically was making it to work, but not doing very well at work, as my boss could attest. I was limping. I was in pain with every step I took. But I still continued to do my job. But it was very painful. I'd go home, and by the time I got home, I was done for. I could no longer do anything else.
Now, Barbara's on the young side, but her symptoms were so severe that there really were no more options for her. Yeah, she was in very bad shape.
Did you use a computer on her?
We did not use the computer on her. Okay, next question is about the surgery, or at least right after the surgery. How was that? Because I'm sure a lot of people are scared. There's a fear of being in the hospital, having had surgery. Are they going to be in severe pain, or what's it like?
I was one of those people. When he told me I was going to have a spinal, I very calmly was talking to him, but inside I was shaking. I had a spinal at one other time, and it did not work with me, and I was terrified. But I had the spinal done here. I don't even remember having the spinal done. And I was in no pain, very little pain after I went back to my room and they got me in my room. Even in recovery room, I had very little pain. The nurses would ask me how I was doing, and it was, "I'm fine." "You having pain?" "No." It was working out. The block that they had put in my leg was like, I can't even explain it. It's just not having pain. And for somebody who's had pain for 20 years, not to have pain in that knee was a blessing. And even the couple of days that I was in the hospital, the pain wasn't there. And yes, they do get you up. If you're thinking about that question, yes, they do get you up the first day. You are dangling. They do get you up and have you stand a little bit. The second day, you're up walking. Rick will take you down the hall. So I can guarantee you, he'll have you up walking. And the pain management that the doctor does was fantastic. I mean, I couldn't believe that I wasn't going to have as much pain as I thought I was going to have.
Yeah, we can ask questions if you want. Not too many. I was going to ask you that anyway, but yeah. What'd you do next? Did you go home? Or?
I went to rehab at Health South in Pinton Falls simply because I live alone. I have nobody home with me. So I chose to go to the rehab. And I think it was one of the best choices I made because, believe me, when I was at rehab, first day was a little shocked because when they told me I was having 5 hours of physical therapy that day, I was like, you sure? But yes, they set me down in periods of hour at a time, which we did physical therapy for 3 hours down in the gym area and then for 2 hours in my room with other physical therapy work. So yes, it was.
How long did you stay there?
I stayed in the rehab for 4 days.
Oh, okay.
Was the pain then?
It's quick.
There was a little bit of pain, but not much because the rehab followed Dr. Nasar's plan for my pain management, and they kept me with my pain medicine that it wasn't wearing off, so that I really wasn't in pain.
Do you have arthritis?
I have rheumatoid arthritis.
Was the operation on one knee or two?
Right now it's on one knee, and Thank God that I haven't had to do it on the other one.
Not yet, hopefully not.
There's no inpatient rehab in this hospital,
Yes, I did have outpatient rehab here.
but not inpatient.
Inpatient, yes, the first 3 days that I was in the hospital, I had inpatient rehab. Yes.
And what about returning to activities? Can you tell them how soon were you able to walk without, let's say, a cane, or you were using a cane?
I started out with a walker. By the time I went home, I think I was only with the walker for one more day, a couple of days after that. And then a cane for maybe 3 days after I started doing the outpatient physical therapy here. And I was driving within 6 weeks.
And back to work was...
Back to work in 8 weeks.
And she does a lot of walking, a lot of lifting, so that was pretty much appropriate. It depends on, I get asked a lot about going back to work. For sedentary jobs, you can go back a little sooner, but 8 weeks is about right. And how was it getting back to work so soon, at about 8 weeks?
The first week was just a little shaky, but I took it easy. My boss was very lenient. She did give me help in my area, and I was able to sit down if I needed to sit down. But I was fine with it. I was dying of my pain. He saw me.
We don't work together that much, but I saw her in the halls, and she was doing nice. Thank you very much.